so everyone can join. So welcome to CNS Connect Webinar Series. My name is Amy Smith, and I am the Certification Programs Coordinator for the ANA and the BCNS. And today I am joined by Dr. Camille Freeman, and we are going to discuss how to price your services. A couple announcements before we get started. If you are a CNS, you can earn 1 CE from today's webinar. We recently added category number 5, which is the participation as a learner in professional and structured education. And this activity does not have to contain nutrition content. So you can earn up to 10 CEs per recertification period in this category. If you have questions throughout the webinar, just put them in the Q&A or the chat, and Camille and myself will work to moderate those and answer them as they come up. And I will post a survey at the end of the session for the CE credits. So Dr. Camille Freeman is joining us today. She has been in practice as a registered herbalist and licensed nutritionist since 2003, with a focus on fertility and menstrual health. She runs Monday Mentoring, a community of practice for herbalists and nutritionists, and offers courses for highly trained herbalists and nutritionists who need help building and growing their practices. Camille is a professor at MUIH, where she teaches in physiology and pathophysiology and holds a doctorate in clinical nutrition from MUIH, as well as a BA in English from Rice University and an MS in herbal medicine from MUIH, and an MS in physiology and biophysics from Georgetown University. So thank you, Camille, and I will turn it over to you.
Awesome. Let me just share my screen. There you go. Great. Thanks, Rachel. Hi, it's so nice to see everybody. And thank you, Amy, for that really lovely introduction. I'm really happy to be here. I see a lot of familiar faces and also some people I don't know as well. So the way we're going to do this is I'm going to just launch right in because we've got a lot to cover, and we're going to have plenty of time at the end for questions. So let me go on to our next slide. So just very briefly, I know Amy did a nice intro there. I want to just give you a little bit of background in terms of the clinical work that I've done so that you can understand where this pricing info is coming from. So when I started practicing right out of school, I was working in an OBGYN office as a contractor. And after that, I've worked in group practices. I've worked in a large fertility clinic. I've worked in private practice, both in person where I was, kind of renting space from other people. And then also since, I don't know, 2010 or 11, I've been fully virtual. And so throughout all of those different practice models, I've had times where I get to choose my price. I've had times where the price is told to me. I've worked in a lot of different situations, and I've tried a lot of different pricing models in terms of accessibility, affordability, making things work on my end and so forth. And so I'm bringing all of that in here to this conversation. And I'm also going to share some information that I've gleaned from working with people as a mentor as well. And I've worked with a lot of people in terms of how to come up with their own prices and in different situations, and what might work and what might be worth thinking about and so forth. So as we go into the next part here, I'm going to just kind of go over our plan for today. While I'm doing that, I would love it if you have a chance, and I know some of you may not be able to do this right now, but if you have a chance and you could put in the chat area just where you are in your practice. Are you thinking about getting started? Have you recently started? Have you been doing this for 5 or 10 years? I'd love to just get a feel for kind of where you are at the current moment, if I can. So here's what we're going to do in terms of what we're going to talk about right now. First of all, we're just going to talk about basic numbers. I'm going to give you some guidelines, things like that. We're going to talk about how and whether you should care about what other people are doing and how to understand that. We're going to talk about factors that might affect the price that you come up with, either in one direction or the other. We will also talk about accessibility and different pricing models that you might want to consider, because I know a lot of people would like to meet their own, many people have student loans and these types of things. You need to meet your own needs, but also you want to make this work accessible to people who need it. And how can we balance that? And then we are going to have plenty of time for questions, because I know people always have lots and lots of questions here. So thank you so much to everybody who's typing in here. We have a lot of folks who are just getting started, students who are graduating. So I think this is a good time to be thinking about this. But I will say that a lot of this is things that you're going to reevaluate periodically. So even 10 years from now, you're still going to be thinking about this. You're still going to be playing around with it. And these are things that you don't just make one decision and then that's your price and voila, you're done. All right. So let us launch in. It's just really nice to have all of you here, and thank you for sharing where you are. All right. So numbers, facts. This is one of the things that many people are like, oh, the ostrich method, and assume it's all going to work out. Sometimes it seems really scary to start to think about all of the possible expenses, how much you need to make, how much you need to charge, and so forth. However, it's really important to do this. So one of the things that I'm going to make an assumption here, that if you're in this webinar, that you are approaching this as a job and not as a hobby. And sometimes people sort of span the two, and that's what we call a jobby, where you're like, oh, I'm sort of going to pretend it's a hobby, but I want it to be a job, but I don't want to fail at it. So I'm just going to do. We want to think of this as a career, as a profession. Now, if you did this as a second career and you're sort of like, I don't really care if I make money or not, I just want to help people and blah, blah, blah. This conversation may or may not be as relevant to you. What we're really talking about here is people who are like this, I want this to be a substantial part of my income. Some of you may have other things that you do as well, but for many of you, you'd like to make your living fully doing this, or at least, a good chunk of it. So we want to think about this as a job, as a career. And one of the fundamental pieces of a job is that you make more money than you spend, that you cover your own basic needs and expenses, and then you have a good life where you're able to cover not just the basics, but also take time off and contribute it to causes that you care about, and have a nice vacation every now and then, that type of thing. All right, so that's where we're really thinking here. I'm sorry to tell you about this middle one, this middle point here on this slide, but a lot of people come out of school with an unrealistic expectation about how long this is going to take and what should be happening. So if you're thinking, oh, I'm going to graduate, I'm going to get everything in line, I'm going to open my doors, and then I'll see 10 clients a week, or I'll see, 7 clients a week or 12 clients a week, whatever. That is probably not going to happen unless you happen to have a very large network. You're already, a huge social media person, or you've been doing a different career and you've got lots and lots and lots of connections in this field, or so forth. For most of us, it's going to take at least 2 years of consistent, regular effort, and I will add, failing at things, before you're going to have a pretty steady, predictable practice going. So I want you to plan for that. You're not doing something wrong if 3 months after you graduate or you open your doors, you're like, oh, wow, I saw 1 or 2 clients this week or this month. That is okay. That's part of the process. It's going to take time and you're not doing anything wrong, but you can't just do that and then be like, oh, well, I'm not good at it. I don't know how to do this. Never mind. This is a whole different webinar. And I think there's some other webinars in this series that address how to find clients and all this kind of stuff. So I'm not going to go into that here, but I will say before we move on that in the beginning, most of you do not have any training or very, very little training in terms of marketing and promotion. And so you're new at it. You are a beginner. You're kind of like somebody who's eating the standard American diet and is looking to get healthier. So most of us are not going to take that person and be like, all right, well, we're going to do a complete overhaul, fully, whole foods, plant-based, whatever is your ideal thing. You're going to take small steps, and they're going to kind of mess up sometimes. And they're going to go to the movies and they're going to get something really, really not ideal. And then they're going to be like, oh, well, never mind. I just blew it. I'll just eat whatever I want for the rest of the week. You're going to do some of the same stuff when it comes to marketing. And the reason that I know that is because that's what happens to everybody. All right. You're going to be a beginner. You're going to make mistakes. And then your mind is going to say like, I want to give up. Never mind. I'm not good at this. Oh, well. Or you're going to be like, maybe I need to spend $3,000 on some fancy program to tell me how to do this. None of that. What you need to do is use your brain. I know you have a really good brain because you made it through school, you made it through program, you're here. You're going to use your brain and you're going to start thinking, all right, that didn't work. What else can I try? How do I connect with people? And so on and so forth. Like I said, I'm trying not to make this into a how to find clients webinar. So I'm going to move on from that, but just know you're going to have to try things that don't work in order to find things that do work. There's going to be some failures. There's going to be some successes, and it's all part of the process. It is okay. It's going to take a couple years more if you have less time. So if you've got, young kids, if you've got another job, if you've got ailing parents or whatever, lots of things going on, if you're oppressed by everything that's happening in the world, which is legit, it can take longer than 2 years because these things take time. The people who succeed are the people who are like, all right, it's hard. I'm just going to keep going and do as much as I can. Okay. The other thing about these numbers, when we start to really get into them, is that when we're coming up with our pricing, we need to remember that we're part of a network. We're part of a community, not just the community of where we live or the clients that we want to work with or that sort of thing, but also a community of other professionals, including everybody who's here on this webinar, including the wider community of nutritionists in general, and then including even a wider community of healthcare professionals, allied health professionals, whatever you want to say. So where you price yourself also affects all of those different communities. And so we want to really take that into account when we're coming up with pricing. What I found that is most common when people are doing their pricing is that you are taking everybody else into account and not yourself. So we're going to talk about that next. How do you find a good price for you? Okay, the very first thing, and I really, really need you to listen to me here. Like if you take nothing else away from this, I really encourage you to sit down at some point and start to think about how much you actually need to make ends meet. Because as you know, if you've even thought about trying to start your practice, as you know, there are expenses. Even if you have an entirely virtual practice like I do, I don't have to pay for rent or office furniture or things like that. I still have to pay for insurance. I still have to pay for the practice management software that I use. I still have to pay for my licensing fees. And, I get lots of coaching so that I can kind of keep going and motivate myself. But there's all these expenses that come up. So I need you to know about how much it takes to run your practice. At the end, I'm going to share some resources. I actually wrote up a blog post a while back. It's been a couple of years now, but it might still be helpful for you about how much it cost me to start my practice. I took a little break after my kids were born, and then I restarted many years later in 2019, I believe. And so I really kept track of exactly all the different expenses. So I'm happy to share that with you if you would like to see just an estimate for my own practice virtually, how much it took to just get it up and running at first. But I need you to know that, but I also need you to know what expenses do you have that you need to cover? All right. So like how much is your mortgage or your rent? How much are you spending on food? How much are you spending on, kids stuff, if you have kids, or dog stuff, or whatever, all your basic expenses, your health insurance, if you don't have somebody who's providing that for you, life stuff. I need you to know if I'm really going to make my living doing this, how much do I actually need to be making? So there's two parts of it. One part is how much is my business costing me? The other part is how much do I actually need to be paying myself in order to make this work? Because it is one thing if you're like, okay, I'm independently wealthy, or I have a different job, or my partner has a different job, or whatever. I don't really need to make a living with this, or it'd be nice to supplement with a little bit, but whatever. Versus I really need to be able to contribute or fully take on my household budget. You need to know that number, okay? Because you've got to have something in mind so that you know what's sustainable for you. If you don't know what's sustainable for you, I promise you there's a good chance you're going to get a year or two down the line, and then you're going to be like, wow, I'm not making ends meet. I'm having to borrow from my savings or my retirement or whatever, and I can't do this. You're not going to be able to stay in business, stay in practice, and keep serving people if you don't know how much you need to sustain yourself. Most people like to do this in two ways. One is like a minimum where you're like, okay, I think I could basically make it work at this level. And I think I could have a very comfortable life at this level. So it might be nice to have both of those numbers, but I really want you to have both. Once you have these first two in mind, I also want you to start thinking to yourself, how much do I actually have the ability to work? So that's going to be different. Some of you are like, I can work 40 to 50 hours a week, no problem. I'm all in. This is my main commitment. Others of you are like, well, I got to pick the kids up from school at 3 every day, or I have another job. My mom's, in hospice. I'm prioritizing time with her, whatever it is. So I need you to realistically think, how many hours can I do this? I also need you to think about your own capacity, because, for example, I know from having done this for 15 or however many years, if I try to see more than 4 clients a day, I'm done. I'm burned out. I cannot, by that 5th client, I'm not really functioning at my optimum level. There are people who can see 10 clients a day, no prob. They have a different model than I do. But for me, I really have a very hard limit at a certain point. I also, I just have a sense for my own capacity, and I have a sense for how many hours I have based on the other things that are going on. Then you're going to factor in, do you need a break? Do you need some time off? Yes, you do. The answer is yes. Don't say no. You're not going to work all 52 weeks. So give yourself at least 4 weeks, in my opinion, or you're not working. So think about, how many hours do you have realistically in a week? And then I want you to factor in that, let's say you decide you've got 20 hours a week that you can devote to this practice. Only about half of those are you realistically going to be seeing clients. The other half you are going to need to be spending on marketing, promotion, and admin. Okay. So think about that. If you can see people, you've got 10 hours a week, maybe that looks like, 2 or 3 new clients and 4 or 5 follow-up clients or something like that as a max. If you can get those people all coming in, what do you need to charge in order to get where you need to go? One of the biggest questions that I get a lot of times is, how do I think about how much money I need to make in my expenses? So for those of you who are not familiar, there's a book called Profit First. The name of it just makes me like, oh. However, it's a really good book. I regret to inform you. So I recommend reading it if you haven't already. But essentially, this is just a framework for how to think about the money that comes into your practice, because the money that's coming into your practice is not just going into your bank account. Okay, you've got expenses, you've got taxes, and things like that. So the Profit First model, which applies, I tell people the first 6-ish months that you're legitimately trying to make this work, you're going to probably be in startup phase where you're going to be spending more money than you're making, because there's a lot of startup costs, like, setting up a website or your practice management. There's a bunch of things that are going to have to happen that it's going to take some time to equalize. But once you really get going, this is approximately what you should plan to happen with your money. So whatever comes in, you want to take a number for some of you. So what that means is, if you make $1,000 a month, 500 of that is, you've got about 30% for expenses, meaning how much it costs for your practice management software, if you're using any, and your email service, and your all the things, your insurance and your licensing and your CEUs, unless you're doing this free one, which is great, that kind of thing. So you've got 15% that you want to set aside for taxes. That's going to be plus or minus. You got to speak to your own accountant, blah, blah, blah. I'm not an accountant. And then 5% they call for profit. I'm not going to go into all of that right now, because that's a bigger conversation. But so what that means is, if you're thinking to yourself, I really need $4,000 a month to run my life, to pay for my kids and our food and our rent and like whatever, that's how much I'd like to make. That means if you want $4,000 in your bank account, that your business, your practice needs to be making about $8,000 a month. There's a lot of dollars a month. So you need to start thinking like, oh, okay, if I can see 10 clients a week, at $8,000 a month. What am I going to need to charge them in order to make this work? Is that viable? Is that feasible? But I want you to have this worked out. You don't have to start there, and we're going to get to that in a minute here. You don't have to start with that, but I need you to know that in order for me to kind of work this out, this is approximately, I need to see approximately this many clients at approximately this much. Okay. And like I said, sometimes it helps to think minimum, like this is how much I could make it work. Wouldn't be ideal, but I could at least kind of get by with this. And then this is how much that would feel really good to me and very expansive. Like I could do the things that I want to do and show up the way I want to show up in my life. Okay. After this, it's got a link to the book. And there's actually a podcast episode I did about the book. In case you don't want to read the book, you just listen to the podcast episode. All right. So now and obviously you can't do this right now during this session, but after this session, at some point, you're going to think about all this. So after you've come up with a loose estimate of like, okay, here's how much it costs me to run my practice, and here's how much I would like to be making in terms of my income, then you've got to think about, okay, now I'm actually going to set my prices. And sometimes you're not ready to do that full price that you came up with before. So some of the other things that are worth considering potentially are, number one, what are your colleagues charging? I'm not saying that you should just see what they're charging and charge that. That may or may not be something that's relevant, but it is worth knowing. And I usually tell people to look around in your geographic region if you're going to be seeing people in person. So you might, for example, I live in Stanton, Virginia. I might look at, 3 or 4 of the larger cities around here and see what are nutritionists charging in these areas and get a range. Like what's the least expensive, what's the most expensive of people who have a similar credential to me. You might also do this within a specialty. My specialty, like Amy mentioned, is fertility and menstrual health. So I might do a web search to see across the country, what are people who have a specialty in fertility nutrition charging? Again, on the low end, on the high end, just to know. And then you would also want to think about, who am I hoping to work with? Again, niching is a whole different webinar as well, but I hope that you've considered having a specialty or a niche or something like that. And you want to think about those folks and like what's within their capability or within their like realm of possibility and what may or may not be. Now, there are times when you're going to choose knowingly to go towards one direction or the other of these ranges. So I'm not saying just pick it and go with it, but it is really, really good to know, because if you are, let's say you realize, oh, in my specialty, prices for a first visit and initial consultation range from, $200 to $450 or something like that. And let's say you're like, okay, well, I want to be on the low end. I'm going to charge $150. That is a choice. You absolutely can do that. And we'll talk about when you might want to do that before. But what's going to happen is, if you charge at the low end or lower than the low end, you're going to start to attract people who are bargain seekers. And that may or may not be the type of client that you really want to work with. Depends on your marketing, because sometimes you really are making it accessible and affordable and you're getting folks in that group, and those folks can be very, very motivated. But sometimes you're just finding people who are like, I just want to pay whatever's the least one, and they don't really care other than the price. May not work out for you. And sometimes you're going to have people who look at that and they're like, oh no, I don't want the least expensive one. Sometimes like when you go to the store and you see different cheeses and you're like, do I want the cheese that costs 25 cents? Go for something a little more high end here with the cheese. Sorry if anybody here is dairy free, but anyway, you get what I'm saying. So you want to, that's a choice. That's a choice you can make, but there are implications to those choices. But again, I want you to at least know these ranges going in, because it helps you provide a little bit of context for what you finally decide. Some other factors that I want you to think about when you're coming up with your number are your skill and experience. If you're brand new, if you are right out of school, then I think there's a case to be made for starting on the low end. You can absolutely say, you know what, I'm going to do my first 5 clients at a very, very low price. And then as I get a better feel for what I'm doing, as I get in the flow of things, as I am better able to describe the benefits of working with me and my special, approach to this, I'm going to go up a little bit. So that is a legitimate strategy, not to be like, I'm charging this much forever, but to start really low and, kind of acknowledge that you're a beginner. This may be your first client or whatever, your first client out of school, whatever else, and work up from there. Conversely, if you've got 15 or 20 years of experience in this field, if you have another credential to bring in, let's say that you've been a nurse for the last 25 years and now you've added this nutrition piece, that's going to potentially affect the promotional materials. The business strategy is what I was just talking about. One of the things that we need to factor, especially once you start getting into higher price ranges, is that where are you planning to get your clients? Because if you're planning to get your clients, from word of mouth, or if you have a good referral relationship with a physician or, somebody else, then a lot of times the price is less of an issue. And people are like, oh, I've got a really good referral from my friend. They loved this person. I'm happy. I really want to sign up. They're going to sign up. But if your plan is like, people are just going to kind of come across you on social media or SEO or something, it's really hard. I think about how many times you've done this lately. If you've been looking for a practitioner or something and you stumble across somebody, you've never heard of them before, you don't follow them on social media, they're new to you, and you're just like, oh, do I want to sign up for their $400 3-month package? That seems like a big leap, right? It's kind of like, I just met you on the internet. I don't think I'm going to just sign up and tell you my life history and all about my bowel movements right this very second for $400. So sometimes as a business strategy, you might say like, I'm going to do a low cost initial thing where people can just come get to know me a little bit. And then if it's a good fit, I'm going to say like the next step is this plan or this package or something that's more in line with what you actually need to be making to be sustainable. So you're going to offer people like a small, what they call a bite-sized offer. And that is a business strategy. That's something that you can choose. It's highly dependent on your own situation, but that is one option. You also want to think about how you're talking about yourself. This is this third one here, marketing and promotional materials. Because let's say there's 4 fertility nutritionists out there, and the range, like I said, let's just pretend it's $200 to $450. And I'm like, I'm going to charge $575. But I don't say anything different in my website or in my marketing materials. It's all the same. There's really no reason for somebody to pick me versus one of the ones who costs in the sort of standard range. Like, why would you pay double for somebody where there's really no difference? Versus if I say, oh, I've got 20 years of working in fertility, whatever kind of fertility situation you're having, I've probably come across it. I have a lot of connections within the fertility community. I understand the procedures that are happening. I understand the safety, blah, blah, blah. If I can explain it like that, then there are people who are like, oh, that's what I want to pay for. I'm happy to pay extra for it. So you need to think, like, is there a reason for somebody to pay either more or less than whatever the standard range is? And are you explaining that well? You don't want to get into a thing where you're justifying your price, but just explaining like, here's what you get. Here's the advantage of working with me, my approach, whatever it is. In the beginning, you may not have that, and that's okay. What you have to offer is your brilliant training, your brilliant mind, your caring, your compassion, all of that kind of stuff. Of course, your client base is worth considering. If your clients are, for example, if you're like, I really want to work with the college crowd, those folks are not known for their financial abundance. So you have to start thinking like, oh, okay, is there a way to account for that? Do I do, lower cost programs? Do I market to people's parents who are paying for their children to be in college? Are there different ways that you can make that work? And then the last one here is intuition and comfort. And this one I think is a really worth thinking about. One of my mentors, his name is Mark Silver, but he has an exercise which I really think is very valuable in terms of finding your own intuitive place where you feel good about what you're charging. Because one thing I will tell you from my years of being in practice is that If you don't feel good about your price, if you feel like it's either too low and isn't sustaining you, or it's too high and you're like, I don't think I should be charging that, it's not going to work. It just won't. I know that's like a little bit woo-woo, but I can absolutely guarantee you that you have to feel really solid about your price. Like it's a great value for you and it's a great value for their clients. You've got to get to that point. So how do you know where that is? Well, I'm going to share this exercise with you from courtesy of Mark Silver. And what he recommends is that you start and you say to yourself, like, okay, what if I were to come up with a number that's just ridiculously low, like $5 for my initial visit or my package or whatever it is you're trying to price. And obviously that's going to be like, I couldn't even cover the cost of, the cost of the paper to print out something for that. And then think of something that's ridiculously high. Like what if I was charged $10,000 or $5,000 or something that feels just like, no, that's not okay. And you're like, okay, those two are out. And you just work towards the middle. So you say, okay, what about not 5 isn't going to work? What if I charged 25 for an initial visit? For most of us, that's probably still going to be like, I can't, like if you got to pay for childcare or something while you're working with people, or you got to pay your student loans, whatever it is, that's not going to work either. And then you're like, okay, instead of 1,000, what if I charged 700? You might be like, no, still too much. And you just work in a little bit. So you're like, okay, what about instead of 25, what if I charge 75? What if I charge 100? And at some point you're going to get to where you're like, okay, that's low, but it's not outrageously. Like I could probably do that, at least for some clients. And same thing on the other end. You're going to be like, well, I don't love the idea of charging $250, but I think I could. Like I would feel good. Like people are still getting, it'd still be worth it to them at that price. And so then you've got yourself a little bit of a range where you're like, okay, this is kind of a low end that feels good to me. And this is a high end that I could charge without feeling like I've really pushed it way too far and this isn't a good idea. So you want to find that range as well. So excuse me, taking into account all of these different things, you are going to eventually wind up with a price or a range that you want to start with. And one of the reasons that I tell people to start with is because you get to change it anytime you want. It's your practice, it's your business, and there's no right way to do it. So let's say you decide and you're going to charge, $75 for your first 3 clients just to get yourself out of the gate and like practice and whatever. And then you do that. And by the time you do your 3rd client, you're like, this is not sustainable. I can't even believe I'm doing this. You could double your price the next day. You can go to $150. And I promise you, it is fine. You can change your price anytime you want. You are the only person who is really paying attention to your prices, your website, etc. Most of your clients or people who are interested in your work, anything like that, are not really going to notice. They aren't. I promise you, it is just not that big of a deal. Okay, so people think about it like, oh, I'm going to raise my prices, and like, I don't know. And what if, or you can lower them. If you start out at $250 and you're like, nobody's coming, and I feel weird about it, and I don't like it, and I want to try $150, just lower them. You think to yourself like, oh no, what will people think? And they'll think that I'm not getting enough clients. No, they won't. Nobody is thinking about your prices. You just, like announcing a new price system, initial visits are $150. Most people are not going to remember what they were before. You get to make that decision. Totally up to you. The other thing that I want you to think about is once you've decided on your price, and I know I'm not giving you a number, I'm just giving you things to think about. And I'm telling you that it's okay to just pick one and start. Just pick a place to start, do it, start charging it, and see what happens. But I do want you to keep track of what's happening. I do want you to keep track. I want you to think to yourself like, okay, I would really like to do 5 clients at this $100 level or whatever it is that you've come up with. I'm just saying numbers here, so don't get attached to them. Then keep track of it at the end of every week or at the end of every month. Write down how many clients did you want to see? How many did you see? How much did you charge them? And have a look. How much did you spend? I want you to be keeping track of how much you're making, how much you're spending, what your goals are for how many clients you're going to see, how many you did see, and so forth. Okay. So Amy's got a great question here about follow-ups, changing prices for follow-ups while working with clients. Do you keep their sessions the same price, only increase the new ones? Totally up to you. You can do it any way you want. It's easier for you if you just raise everybody's prices all at once. That is typically what I do. And I will, what I'll do is I'll send out my current clients a note and I'll say, hey, I'm just FYI, I'm raising my follow-up prices on X date. I actually just did it on April 15th. So I sent this out in, I guess May or late May, no, March, sorry. Gotta get my calendar straight. Late March, I just sent everybody who I'm currently working with a note. I'm raising my follow-up prices, not much. I was just raising them $10. And I said, if you want to buy them at the current price, I offer singles or packages of 3 or 5. And I said, you can buy them at the current price if you want. Literally nobody did. People are just paying the new higher price when they want their follow-ups. So it's up to you if you want to be like, oh, these people are at this price and these are at this price. Great. But frankly, especially if you are one person, show, it's just a lot of admin for you to try to remember and set it up so that, so-and-so gets the $75 one and so-and-so gets the $99 one and blah, blah, blah. My recommendation is just, it's the same follow-up price for everybody and just give people a chance to buy some before the price goes up. All right. Okay. So please though, don't just wing this. At the end of the year, you should have something at the end of every month that's like, hey, how many clients did I want to see? How many did I see? All that kind of stuff. Please keep track of it because I promise you're going to think you're going to remember all this and it's obvious. And of course, this is what happened and you will not. It's really putting it on paper and saying, I would like to get 5 clients this month, or I'd like to get 2 clients this week. Write down your goals. And then when you're like, oh no, I don't have 2 clients. Okay, what do I need to do to get 2 clients? Try the things, put yourself out there, make some mistakes and see what works and what doesn't. Again, I'm trying not to veer too much out of pricing, but like it's all connected. Okay. Okay. So Nicole, how long do you recommend staying out of price range before you change it if you aren't reaching the goals? So this is where I think it really helps to have either an accountability group or a mentor or somebody else to give you some outside perspective. Because if you have a price, let's say your price is 100 or something, and to you, it feels like a low price, but you're not seeing enough people. And you start to think like, oh, what if I did 75 and then I would meet my goals? The problem is it's probably not your price. It's probably not your price. It may be your price, but most likely it's not your price unless you feel weird about your price, in which case it might be. Most of the times it's because you're thinking that this is a field of dreams situation where you're going to build it and then people are going to come. And what actually needs to happen is that you have to be out there meeting people, if they're staying in touch with them, being at the top of their mind and like really connecting with your community and thinking about how you frame things and like really, really trying repeatedly over and over, showing up for people, helping them, inviting them. And if you're not doing those things, it doesn't matter what price you have, it's not going to work. But if you're considering changing your price because it's not working and people aren't coming to see you, I really, really encourage you to get some outside perspective to tell you if the price is the issue or if they're to really have a look at what you're doing to promote yourself and see if that's the issue. And almost always it's about the promotion piece, because you just like telling people once on Facebook that you're available to help them or having a website, or that's not going to bring people in. There's like it's an active process. Okay. So let us talk briefly about pricing models, and then we're going to have time for questions. I feel like I missed one already. So, here's a couple of things. The pricing model that many people use is just what you see is what you get. So the price is 100. That's it. If you like it, sign up. If you don't, good luck to you and find somebody else. That is one pricing model. A lot of people are like, oh, but I don't want to do that because I want to be accessible. Like I want people who don't have as much money to be able to come in and see me and that sort of thing. So a lot of people, the first thing they turn to is a sliding scale. And this is the kind of thing where you say like, oh, if there's different ways of doing it. Like if you make this amount of money, this is your price. And if, blah, 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 if this is your situation, this is your price. And you kind of let people pick where they fall on the sliding scale. I have tried a sliding scale. It's been my experience that's really, really challenging for people to place themselves on a sliding scale. So I've done this, for example, where I've had people place themselves pretty low on the sliding scale and then, show up to their appointment and talk about how they've like gone to this really fancy music festival that I could never afford to go to at the time. And I'm like, okay. It gives people this extra decision. And sometimes I think prevents people from coming to see you. So you absolutely can try a sliding scale. In the resources page that I have for you, I've given you some examples of different people who do sliding scale, as well as a really lovely description that about how to place yourself, so people can understand like what does it mean to be at the bottom versus the top and that kind of thing. But you can absolutely try that if you feel like that's the way to go. It does bring up some administrative concerns as well, because then it's like, oh, you got to ask them where they want to be so that you can invoice them, which is a whole nother conversation, and that kind of thing. Bartering is an option. I have done bartering. I've had somebody offer me a refrigerator in exchange for my services, which I did not need. And also I'm like, how am I going to get a refrigerator? Like, I mean, it didn't work out. Bartering is also a challenge because sometimes people will offer you things that you don't really need. And technically, you actually have to pay taxes on barter, to things that are traded to you. So the actual worth, like if you traded for $100, then you owe the taxes on that $100. And so you don't want to barter for something that you don't actually need. And of course, sometimes people don't follow through on their barter, or they send you something where you're like, I don't love this, like it's not in great shape or whatever else. So if you want to do bartering, my recommendation to you is to have a list of things that you would actually need or use, or that would be helpful to you, that you would pay money for legitimately elsewhere, otherwise, and be like, if you want to barter something on this list, please get in touch. But I don't do barters outside of this. So that's something to consider. But like I said, it is a challenge, and you need to make sure that these are, whatever you're bartering for is something you need. There's also a pay from the heart model. This is actually what I'm currently using. And the way pay from the heart works is that you just, I should clarify, I'm using this for my mentoring programs, not for my clinical work. But the way that pay from the heart works is that you just give 3 prices for the same thing. There's no difference in terms of what people get, but it's just like, this price is the minimum that we need to cover our costs. This price is the price that we need to pay, you or anybody else involved in the program a sustainable living wage. And then this price is the price that we can use to, share this work with people who can't afford it, to expand our programs, whatever, to grow and thrive. And you just let people pick where they are. So you're not, there's choices, but it's not unlimited choices. So I actually find that the paying from the heart works really well, because when I first started doing it, I thought like, nobody's going to actually pay that higher level. And the first time somebody did pay that higher level, I remember I was like, oh my God, they must have clicked the wrong button. I should contact them and like tell them that they've made a mistake. But no, people actually pay the higher price all the time for a variety of reasons. And people pay the middle price all the time for a variety of reasons. And then people pay the lower price. So it just takes me out of it. I'm like totally released from any involvement. There's just a different button. One of these 3 buttons, you pick where you are. I don't even know most of the time. I try to like not even look to see who's paying the high and the low. I just treat everybody the same. And then that's how it goes. And then the last model you might want to consider is subsidizing. And what this means is that you charge the price that you need to cover your expenses, to pay, whatever living wage or however much you want to make, you charge that amount. And then either you offer some free visits to people, so you kind of have like a balancing the scale a little bit. Perhaps you work in a free clinic, something like that, or you charge a little bit more and you use that extra to subsidize some people to have a lower price. I actually use this model in my private practice. So I charge a pretty reasonable fee to work with me one-on-one, but then for every 2 people that I work with that are paid, I offer one free. I work with one person for free. I actually really strongly recommend that if you want to do this, if you want to do it like a subsidy model, if there is a free clinic already established in your community, plug into that, because they're going to have better networks. They're going to have better access to people who really need it. They're going to have better systems in place. You're going to actually get to know other practitioners and really support your community more. So ideally, if you want to do some work giving back to the community, see if you can do it within the context of an organization that already exists versus trying to start your own thing, which is going to be less efficient. And you also probably have less training and experience in terms of doing that. The other thing I like to mention, and after this, we're going to wrap it up. The other thing I like to mention for people is that it is not your job to personally take on systemic oppression and, capitalism. Like there's no reason that you personally need to kind of like suppress your own financial needs because of the system that we live in. Okay. So people do feel sometimes guilty for charging a price that other people can't afford. And let me tell you just this, which is even if you charge $10 for your visit, there's millions of people who can't afford that. It's outside of their range. So it's just like there's only so many people that you personally can work with one-on-one, and you need to sustain yourself so that you can go on and do this work and serve people. So if you feel called to serve and to help, absolutely do that, but it doesn't have to be at your own financial expense and your own emotional expense. Okay. You can make money doing this legitimately because you know a lot, you've paid a lot of money to get here, you have valuable things to share, and that is okay. And you can still give back either by free visits, supporting free clinics, donating money, any of that is okay. These are all okay things to do. Okay. So there you go. And then, like I said, I'm going to stop because I want to make sure we have plenty of time for questions, but I don't recommend discounts. I do recommend stating your prices up front so that people know what range you're talking about. Otherwise, it can just waste your time and their time if you don't share your prices on your website or whatever else. Don't recommend groups when you are starting out unless you have a very, very big network. And packages, I think, are reasonable. Again, if you have a package, like I said, that's more expensive, have a lower stepping stone so that people don't have to just jump right into a very expensive package unless they want to. Like, have a way for them to get to know you at a lower cost. Okay. So this is the, excuse me, this is the page where I've got some of the resources up. And then I believe Amy is going to send out the slides as well. So that link will be in there if you want. Okay, somebody's asking me about corporate practice of medicine law. I don't know anything about that. Cannot do fee splitting, kickbacks, or self-referral products. That makes sense. In terms of like affiliate promotions or things like that. Yes, Elizabeth, I think just from an ethical perspective, it's a little bit weird to offer people incentives in terms of this kind of work. So I think that's legitimate, but I'm not as familiar with the specific law. Okay, so Amy's posted the CE survey for people who would like their CE credits. And thank you, Rachel, for your nice words about the pay from the heart pricing. All right, so what other questions do people have? Like I said, I wanted to leave plenty of time. And if I missed your question earlier, please repost it because okay, Rachel, thoughts on putting a price on a printed brochure? I probably wouldn't do that in the first year or two of your practice. If you've been in practice for a while and you have a good sense of how many brochures you will use, then I think it's fine. You know, if you feel like this is my price, it's pretty stable, I'm not planning to raise it for another year or so, and I know I'll use 100 brochures in a year or 200 or whatever, great. If this is your first year and you haven't started yet and you're just guessing at your price, I don't think I would put it there. One thing you can do, and I've seen people do this, it's not as professional, but you know, it is what it is. You can have a place for a sticker. You put a sticker with your prices on it so that if it changes, you've not wasted a whole bunch of brochures, or just order a few and see how you're going to go. But the other thing you can say is just, for prices and more information, see our website. blah, blah, blah. Yes. Okay. So the survey link, I think, just went out. I think maybe it just accidentally went to hosts and panelists at the first time. Okay, Amy's got a question here. Do I recommend packages versus one at a time? I think this depends a little bit on the type of work that you're doing. So if you think that you can make a difference and people are going to get what they need to get from a single visit, then I think it's fine to offer a single visit. However, if the kind of work that you do, if they're really not going to notice benefit and improvement in one visit, then maybe it doesn't make sense to offer a single visit. Okay, so I'd think about that. This is another little piece of advice I have for you on pricing in terms of packages, which is that when somebody comes to your website, you want it to be very, very clear to them what they should choose. So if I go to let's say I'm going to just pick a type of practice that I don't really know anything about, which is craniosacral work. I don't know. I've never done that. I don't know much about it. I think it's some kind of body work. But let's say somebody was like, oh, Camille, you really need to do craniosacral. And I go to your website and you do craniosacral work. And I see on there, they're like, oh, you can sign up for the 3-month package or the 7-month package or the the 2-session package with the hot stones or whatever. I don't even know if that's a thing. I'm just kind of like, I don't know. Like, is it the kind of thing that you do for 3 months? Do I need it that much? Do I not need it that much? I have no idea because I'm a total beginner. So if you have like a 3-month and a 6-month or a 1, a 3 and a 5 or whatever it is, it should be obvious to somebody who's never worked with you before which one they need. If it's not obvious, start with a single visit and then be like, at the end of this visit, we will discuss, whether you should keep going and what would be the best. And then you can offer them a package after that. Okay. So that might be a reasonable way to do it. In fact, that's what I do in my practice. Everybody starts out with a single visit and a follow-up. And then for now, I'm actually changing this in a minute, but for now, if they do that, some people that's all they need. They're good to go. Ta-da. Other people, I'm like, okay, I think we're going to need 6 months to do this. Here's what that looks like. Here's how you can sign up for it, etc. But just make it as easy as possible for them to know what they need and how to sign up for it. So Amy, you can always, if you're worried about the commitment, first of all, just try stuff because you never know until you try. But second of all, you can see everybody once and then make a recommendation about a package if you want to. Michaela, I do not deal with insurance. I'm a one-woman show and I'm like, I have a full-time job as a professor. I don't have time to deal with insurance. So I will give people a super bill, but that is the extent of my insurance expertise and knowledge. I'm sorry. How I got clients early on. Julie, this is a great question. Yes, there's a bunch of how to get clients website or webinars coming up. But for me personally, I've not done paid advertisements. I'm also not on social media specifically. I was for a while, but I haven't been in years. And what it's all about is your network. And I don't mean like having a big social network. I mean, talking to people one-on-one and telling them about what you do. So for example, does your dentist know that you're a nutritionist? Does your primary care practitioner, does your massage therapist, does your aunt, your neighbors, I'm not talking about recruiting them to come see you, but I'm talking about explaining to people what you do, talking about it, showing up at the library and doing a free presentation, showing up at the co-working space and being part of a network of business people in your local area, like showing up, being visible and like actually meeting people one-on-one, staying in touch with them, and building your connections. That is how you build your practice. But like I said, that's a bigger webinar and there's a bunch of other people coming up to talk about that. Yes. And Rachel, I have the same. That's why I have a 2-visit package instead of just one, because I find that people need that second visit. I need the second visit for feedback and they need the second visit in case there's tweaks. But for a lot of my clients, I work with a lot of other practitioners actually who don't really need as much. They just want somebody to look at it and be like, is this okay or not? And then they're fine. So anyway, I like the 2-visit. And Amy, what I'm changing it to, I'm actually right in the process of doing this. Like I literally got it up on my, things to do for today. I'm actually going to a 3-month intensive option for most people, just because I really only have time to work with a few people and I want to work with them deeply. So that's what I've decided to do, that I'm going to work with people. I'm going to see them every other week. I'm going to check in with them at the end of each week, give them feedback every week. Like we're really going to deep dive for a couple of months. And then after that, they can go to follow-ups if they want. But that's just what I decided, because for me, it's not as efficient to do just a person here, a person there. And some people want to keep going and some people don't, and blah, blah, blah. I just want to really go deeper with a few people and work with them, really get things going for a few months. So it's new. I'm going to try it out and see if it works. And if it doesn't, at the end of the summer, I'll probably be like, okay, whatever, try something else. But anyway, that's why I'm changing, because my time has shifted and I have actually been so full. I haven't been able to take a new client in almost 6 months now. And so I'm like, I've got to do something a little bit differently so that I can, so I can just kind of make this work for me and see people who are on my waiting list. So that's what I'm doing. And I'll keep you posted. Oh yeah. Thanks, Amy, for posting the survey again and the pricing page.
Sure, absolutely. So I think we got all the questions. Don't forget, CNSs, to fill out the survey. On the second page, just hit next, because the second page is for people that are watching the recording. So just hit next and go to the third page and it'll let you fill it out, and it will send you to a link that will have a printable certificate, or just save it as a PDF for your records. All right. Well, thank you, Camille. This was I think perfect timing, because we've had a lot of questions about pricing. So I feel like this was very useful. And like I said, I will send everyone the recording, and it will also be posted on the website. And you can join us later in the year. Camille will be joining us, I think, in September or October, later in the year, on another topic. So all the webinars are listed on the website. So we have several coming up in the next couple of weeks. So please check that out.
Yay. Thanks, everybody.
Thank you.
Okay, bye.